Hello, guys. Do you know that somebody can be HIV positive, but because the person is taking the drugs regularly, the person can become negative on testing after a while. It doesn't mean HIV has gone, and it doesn't mean the person should stop taking the drugs. I heard of a story of a woman who, as she was taking her medications, the antiretroviral drugs regularly, yes, she went back for testing after a while. It now showed that she was now negative. Of course, she was previously positive. Then, after giving a testimony in church that she's negative, thank God, which is a good one, the fact that you're now seronegative or undetectably negative by testing is a good one. It means that the antiretroviral treatment the person was taking them as and when due. The person was taking them judicious and regularly and religiously, which is good. So she went to give a testimony, and of course, that she went back for testing after a while and she's now negative, which is a good testimony anyway. But then something happened, and she was told by the pastor to stop taking the drugs, which is wrong because it is those drugs that suppressed the viruses. The fact that we could not detect them in the test does not mean they are not still there. They have just been so suppressed to the barest minimum. So if the person stops taking the drugs, these viruses, they multiply again, and this time around they multiply with resistance because they know there's a drug that brought them down before, so they come with a resistance that will resist the power of those drugs. It's just like you went to fight somebody and the person beats you. If you're coming back to that person to fight the person, you will not come alone. You will come with bigger people, stronger men who will help you beat that person. That is what these viruses will do. So if you don't keep those, if you keep taking those drugs, even when you are seen to be or said to be negative by testing, if you don't keep taking those antiretroviral drugs to keep suppressing those viruses, you will discover that the person will now develop. In fact, the viruses will multiply. The person will easily even tilt into AIDS. You know, AIDS is when the AIDS is actually acquired immune deficiency syndrome, which is at that point the person's immune system is already deficient. At that point, the person will be having all the symptoms and all the diseases that comes with it, the skin manifestations, the respiratory manifestations, a lot. That's when the person really looks sick. And this is because those viruses came back. But then even if you go back to those drugs that suppress them, those drugs cannot suppress them again because they came back with stronger strength and resistance. And that is because this person stopped taking their drugs. And they stopped taking their drugs because the test showed them that they were HIV negative, which actually, in the real sense, they are not negative. It's just that they have suppressed the viruses to undetectable levels. So please pass this message to someone. If the person is HIV positive, takes the drugs regularly, and becomes negative by testing, it does not mean that the person does not have HIV again. It means that the person should keep taking those drugs to keep suppressing these viruses so that they don't multiply and come back with resistance. And at that point, you may even need higher drugs to start fighting them, and those higher drugs are not readily available. That is why most people easily tilt back to AIDS when they stop taking their drugs. Share this message. You don't know who would need it, you don't know who to help. And I wish all that are hearing and listening to this better recovery, stay healthy. It's no longer a death sentence like before. You can keep living your healthy life. Just keep taking your drugs. See you next time. Bye.